Okay, Assalamualaikum warahmatullahi wabarakatuh. I'm Dr. Aisha. Hope all of you are fine and ready for today's class. If you people can hear me, just let me know that my voice is clear. Then I'll proceed further. Okay, thank you. Thank you. So we have already started station 3, neurology, right? And we have discussed Parkinson's disease or Parkinsonism. We discussed stroke, right? How to present, what are high heel points, how it can be given in the exam, and what are the Viva questions, right? Today we are going to discuss myotonia dystrophica. Myotonic dystrophica, again, very important, very important and common topic appearing in cases, right? So you should know. Myotonia dystrophica, easy to diagnose, not difficult. First of all, if you can write myotonia dystrophica, it's a combination of signs. What what are the different signs? Number one, facial signs. I will tell you what are those signs, right? Right now, you just write facial signs plus hand sign. Number three, motor neuropathy and high steppage gait. That is, of course, in motor neuropathy. So when you find a combination of these signs, you should think of myotonia dystrophica, facial signs, hand signs, motor neuropathy, and high steppage gait, which is a component of motor neuropathy. So for the myotonia dystrophica, how now? First of all, how it can be given in the exam? What could be the possible commands? The possible commands can be have a look at the patient and proceed. Right? Have a look at the patient and proceed. Number two, this patient presented with ptosis. Kindly examine the patient and do the relevant. Right? Number three command can be this patient is having gait abnormality. Kindly examine the gait. Right? So these are the possible commands which can be given in the PACES exam, and you should think of your mind. It should click that your patient is having myotonia dystrophica. Now, first of all, what signs on inspection? You can guess. As always, I'm telling you, inspection is very important. Inspection of the patient and inspection of surroundings, right? On inspection of patient, just without touching. Now, please write if you can write. Start from the head. So, frontotemporal baldness, right? A bald patient will be sitting. And number two, a patient might be sitting with wig, right? And a wig, it is prominent and we can identify that this is not original hairs, right? So, wig or frontotemporal baldness, these you should appreciate on inspection, right? On head. Then come on the face. In the face, you will look myopathic face, like drooping face, I mean, because there is wasting and weakness of facial muscles, right? So a drooped appearance of face, which is called myopathic face, right? Then ptosis, then wasting of facial muscles. I will tell you which facial muscles mainly are involved. Then cataract, even you can appreciate on inspection, right? And there might be a walking stick around the patient. There might be um, insulin pump because such patients can have diabetes. So insulin pump might be attached with the patient belt, pant belt, I mean, right? Trouser belt. and goiter. So these are the signs which is quite visible on inspection, and you should, and smooth forehead. Please remember, myotonia dystrophica, you can mix it with myasthenia gravis. In myasthenia gravis, there is wrinkled forehead, while in myotonia dystrophica, there is smooth forehead, right? So these are the signs which you have to pick on inspection, and you should not miss it, right? Make a list and do brainstorming with your study partner. Now again, I'm repeating it, right? You, if anybody missed or could not write, please write, right? Then I will ask from you. Number one, start from the head, and there is frontotemporal baldness. A bald patient will be sitting, or wig. Wig is also quite prominent, right? Then smooth forehead, ptosis, cataract, myopathic face, wasted and drooped appearance, drooping appearance, mouth might be open, right? Then insulin pump might be along the trouser belt, goiter, right? And a walking stick. So do not miss it. This, right? The next come. Now, next come on examination steps. So this is on inspection. I hope now it's clear. Yes, Dr. Uzma, very right. Yes, Dr. Jia, please post. Please make the notes and post, because many candidates they ask me after I finish my lecture. So now start your examination. Now examination steps. You can start from the face, right? Again, from the face, uh, as inspection points, which I told, you will notice like frontotemporal baldness, myopathic face, ptosis, wig, right? So this again you will examine. Now starting your examination, as first of all, with the with torchlight you will inspect the pupil, and you will look for cataract, then the white pupil, right? Then you will check for the ptosis, and again after this you will ask patient. You will check the power of muscles of face, right? And you will start like this. First of all, you will ask patient, please close your eyes and do not let me open. Do you know what will happen when you will in myotonia dystrophica patient, when you will ask patient, please close your eyes and do not let me open, patient will not be able to open because the eye muscles will go into myotonia, right? Then you will ask patient, as we are checking the facial nerve, right? Similar way, you will check the facial muscles. You will ask patient, can you blow your mouth, right? And do not let me press it. So you will blow. You will be able to you will be able to press, right? Because the power of facial muscles is decreased, right? So, and smooth forehead, as already I have told, right? Then you will check the power of masseter, temporalis muscle wasting. You will see in the temporal fossa, and masseter, for masseter wasting and weakness, you will ask patient, please clench your teeth, and you will feel that it's wasted, right? As you are checking the facial nerve, just to avoid confusion, right? So it completes the facial examination. Now again, I'm repeating. You will start from the face, right? Face inspection signs already I told you. After inspection, you will throw light on the patient pupil, white pupil. You will notice as patient could have cataract or cataract surgery previously. Then you will look for ptosis. Number three, you will look for uh, um, facial muscles power. For this eye muscles power, you will check the masseter power, you will check, and you will ask patient, please blow your mouth and do not let me press in, right? And you are checking for facial nerve. And so also you can check the eye movements, but that I will tell you when we will do myasthenia gravis, right? After this, from the face, now you will come over the hands, right? In the hands, you will notice wasting of small muscles of hand, right? In what is meaning of that? It means dorsal guttering, right? Dorsal guttering. This is called wasting of small muscles of hand. Dr. Samreen, Dr. Jia is making the notes, and I'll share in the group that what to look on inspection in myotonia dystrophica. As already I have started, and if I got time in the end, I will repeat. Right? Okay, thank you, ma'am. Thank you. Okay, welcome. So after this, now you will come over the hands. In the hands, you will look for wasting of small muscles of hand. Also, now two types of myotonia you can look for. One is grip myotonia, one is percussion myotonia, right? Whatever. Please do percussion myotonia. You can do grip myotonia as well. You can you can ask patient, please close your hand, make a fist, right? So patient hands will go into myotonia, or you shake hand with the patient. Patient will not be able to leave your hand, and you can check for percussion myotonia. For this, uh, you will with the hammer, you will strike the hypothenar eminence, right? And what will happen? A dent, a depression will appear in hypothenar eminence, right? Which is percussion myotonia. So before checking for percussion myotonia, you will tell patient that this is hammer and I'm going to strike it at your hand. If you feel discomfort, kindly let me know, right? Then you strike hammer on the patient hypothenar. It should not be that directly you are starting striking the patient for the hammer on the patient hypothenar eminence, right? So we finished myotonia dystrophica till now. We finished how it can be given in the exam. Then what could be the possible commands? Then I told you that it's a combination of different signs. I told you the signs, right? Then I told you that what to look on inspection, right? Inspection of the patient in myotonia dystrophica. I told you very important points. Then I told you that how to when to start is examination from the face, and what are the examination steps, right? And then I told you that in the upper limb, in the hands, what you have to do and what you have to look for, right? I hope this is clear. After this, now such patients, as I told you earlier, are having motor neuropathy, right? Now what you will look for the signs of motor neuropathy, right? In the lower limb, you can examine. And what are the signs of motor neuropathy? There could be wasting, there could be distal weakness in the form of foot drop, right? Reflexes can be depressed, right? So these are the signs of motor neuropathy. Again, I'm repeating: motor neuropathy, distal wasting, weakness, distal weakness in the form of foot drop, depressed reflexes, right? So these are the signs. And the patient having motor neuropathy, when asked to walk, they are having high steppage gait, right? So you will examine, when you will ask patient, can you walk for me? Patient will be having high steppage gait, right? After this, now, after doing this examination, examining patient face, hands, legs, gait. Now, if you get time, these are the additional points which I'm going to tell you. Such patients can have diabetes, right? So you can look for any insulin pump or any insulin prick marks, right, in the thumb or index finger. Then such patients can have goiter. You can look for goiter. And Such patients can have different cardiac abnormalities like cardiomyopathy, valvular heart disease, and arrhythmias, right? So you can look for uh, any pulse, irregular pulse, or for any signs of heart failure if time allows. And I don't think there will be much time. So you can include these things: diabetes, goiter, and cardiovascular examination. You can include it in your presentation. Right now, uh, I'm going to present. I hope this is clear. Again, I'm going to repeat. Myotonia dystrophica is a combination of signs which include facial signs, hand signs, motor neuropathy in the lower limb, in the gait, high steppage gait, right? And diabetes, cardiovascular, and goiter. There also they are saying there's hypogonadism. So it's difficult to uh, look for each and everything. No? That's why you have to be very specific and look for the high yield sign, right? So now you have examined your patient. Is this clear till now? If any question, please ask. Then I. Assalamualaikum. Walaikum assalam. Ma'am, I joined late, so I missed that inspection part, but I will take from Gia. Ma'am, hypogonadism, how we will check? Hypogonadism, you will check patient can have gynecomastia and testicular atrophy. So definitely testicular atrophy, you will not check gynecomastia. To check in the exam, this is painful and discomforting. That's why I did not mention it. But okay, if time allows, you can check for gynecomastia. And decrease hairs. Decreased hairs, okay. Yeah, axillary and pubic. So again, it is difficult to appreciate. If patient has shaved his hair, how you will appreciate? Ma'am, I have seen one myotonic dystrophy patient, but a gynecomastia, I haven't seen it. Is it very painful? We can't touch also? No, no, no. It is discomforting. Sometimes it is painful, sometimes, but this is discomforting. So in CLD, in the GIT examination, as always, I'm telling, you have to check gynecomastia, but ask from examiner before checking for gynecomastia. Sir, I want to check for gynecomastia. Should I go ahead? If the examiner says okay, then go ahead. Otherwise, leave. Right? So now, how to present? Now listen. Now I will present. Then you people will present. Right? Uh, you have finished your 6 minutes. Right? You are getting 6 minutes in the exam. 4 minutes. I always say that finish 4 minutes. The command whatever is given to you and keep 2 minutes for relevant examination. Right? Here one thing I want to clear: if the command was examine the have a look at the patient and proceed, so you will start from the face, right? If the command was this patient is having gait abnormality, then you will start directly from gait, right? And if they say this patient presented with ptosis, kindly do the relevant, so directly you will start from the eyes. So please make this very clear that whatever command is given to you, keep it in your mind and you have to follow according to that. And you have to start your examination according to that. Because you are being assessed on the command, whatever is given to you. Right? Dr. Rubia, the notes Dr. Jia will share and then I'll share in the group. Right? So now listen. Sir, I will like to, you finish your examination. Now examiner is asking that what are the positive points or what are your findings, right? Now you will reply like this. Sir, I will like to complete my examination by checking for goiter, insulin prick marks, and cardiovascular examination, right? Because you could not do these things. If you did, then tell the signs. And whatever you could not do, start your examination because as soon as you finish your examination, examiner they start marking you for examination points. So include these things in your presentation so that they give you full marks. I will like to complete my examination by checking goiter, insulin prick marks, and cardiovascular examination. On examination of this gentleman, I found that he is having myopathic phase with frontotemporal baldness, ptosis, and cataract, with evidence of facial muscle weakness and wasting, especially of temporalis and masseter. When asked to close eyes, he was unable to open. On examination of the upper limb, he is having wasting of small muscles of hand along with percussion myotonia. On examination of the lower limb, he has evidence of motor neuropathy as evident. On examination of the lower limb, he is having motor neuropathy as evidenced by distal wasting, weakness in the form of foot drop, and depressed reflexes. When asked to walk, he was having high steppish gait. So, on the basis of this, my diagnosis is that patient is having myotonia dystrophica. Right? So, in this way, you will present.
Excuse me.
Yes.
What about tone in the lower limbs and planters?
The, as patient is having motor neuropathy, so tone can be decreased and planters can be downgoing or mute. And there will be foot drop in the lower limb.
So no need to mention planters and tone in our presentation?
No. Save yourself. Uh, present like this, that on examination of the lower limb, patient is having motor neuropathy as evidenced by distal wasting, weakness in the form of foot drop, and depressed reflexes. If you found that tone is decreased, so you can mention no problem. But as you have to finish your presentation within 30 seconds, so that's why you have to be very specific. Right? No need. See, in this way, if you will start telling each and everything that tone is decreased, plantar is downgoing, and this and this and this, then how you will present all signs within 30 seconds? And an examiner has to ask from you, na, okay, what are the differentials, how you will investigate, how you will manage, right? So leave time, give for examiner to assess you. And this is not difficult, whatever I am telling. Believe me, choose a serious study partner. If you will present 5 times myotonia dystrophica to him or her in the way which I am telling, in the sixth time you will be master. Okay, I repeat. I have available on YouTube in groups. In my audios, I have told how to present. Everything is present, recorded, right? So listen and make your notes. That how to present, because here I am speaking, you might miss anything, but in my audios, everything is safe and recorded, right? So okay, um, like this you will present. I will, sir, I will like to complete my examination by checking goiter, cardiovascular, doing cardiovascular examination and looking for insulin prick marks. On examination of this gentleman, he is having frontotemporal baldness, myopathic phase, ptosis, cataract, and wasting and weakness of facial muscles, as especially of masseter and temporalis. When asked to close eyes, he was unable to open. On examination of the upper limb, he is having wasting of small muscles of hand and percussion myotonia. On examination of the lower limb, he is having motor neuropathy as evidenced by distal wasting, weakness in the form of foot drop, and depressed reflexes. When asked to walk, he was having high steppage gait. So, on the basis of this, my diagnosis is patient is having myotonia dystrophica. Clear?
Yeah, yes.
Okay, good. Any questions so far?
Assalamu alaikum, doctor. Can we depend on eye opening delayed after a firm closure instead of ask the patient to grip hands because it may take time to release the hand of candidate?
In the hands, as I told, you can. There are two ways: either to check grip myotonia or percussion myotonia. But I would recommend, and it is recommended even, that to check for percussion myotonia. If
Okay, and
if you have gone, if you have done percussion myotonia and there is dent and dent appeared in the patient hypothenar eminence, an examiner also they are noticing you, so enough, no problem of there no need of doing grip myotonia.
and no need to depend on opening eyes after firm closure of eyes. Because
You should say that you should depend upon percussion myotonia to make your diagnosis of myotonia dystrophica.
Okay.
Yeah,
I got
this
you.
is this is a pathognomic sign. Initially when you are you know what happens myotonia dystrophica. I tell you one very interesting thing.
Release delay relaxation of muscles.
Yeah. This is myotonia. So you know what happens and what has happened with so many candidates. You know, when you people go with the patient and start your examination, initially you people are greeting, right? And what happens? Some candidate they shake hand with the patient, and you know what happens? Myotonia dystrophica patients are unable to leave the candidate's hand. Ma'am, I saw this. Yeah, so this situation, candidate in this stress, candidate is thinking that why this patient is not leaving my hand. Now candidates wants to get rid of, but what happens? Patient hands goes into myotonia, myotonic grip. So you should make your diagnosis even at this point. Okay, so never think that patient is not leaving you. Patient, patient, patient is ready to leave you, but that poor patient, he's having myotonia. So his hands have gone into, so that's why, so please, so initially if you are shaking hand with the patient and patient is not leaving your hand, so do not immediately myotonia dystrophica should come into your mind.
Okay, doctor, thank you.
Okay, welcome. Yes, there is WhatsApp group for, I have so many WhatsApp group, and you please send me message, I will send the link. Yes, the percussion myotonia, doctor, this you have to perform with the hammer, right? Before with the hammer, you will strike on the hypothenar eminence, right? The rubber, with the rubber, and a dent will appear, and our patient hands will go into myotonic grip. It means patient is having percussion myotonia, and but before performing percussion myotonia, explain patient that this is hammer, and I'm going to strike it at hypothenar eminence. If it is discomforting, kindly let me know. In this way, you will get full marks for patient welfare. Okay, I'm going to share the link of my WhatsApp group.
Dr. Aisha will discuss sinner or hyposinner?
Hypothenar.
Hyposinner. Okay.
Mashallah, all of you are very enthusiastic. Okay, I've shared the link of my WhatsApp group. If you people want to join, anyone is not in group can join. Yes, doctor, please.
Okay, really, I'm sorry. Can you repeat how to examine the face only?
How to examine the face?
Just look first. Face of
Yes.
myotonia dystrophy.
Yeah. Initially, you have to do inspection, right? In the inspection, I told that you have to start from the head, and in the head, you will look for frontotemporal baldness, or patient can have wig. Okay, wig is very prominent. Then you will look for ptosis, smooth forehead, uh, white pupil, wasted, wasted and drooped appearance of face. Okay, because there's wasting of facial muscles. So these are the things which you have to look on the face on inspection and on examination of the face. You will start with the eyes, right? And you will look for white pupil with the torch. You will look for ptosis. You will then you will elicit the facial muscle weakness by checking eye closure, then Nestor by asking patient to clench his teeth and by asking patient to blow your mouth, right? And then you will come over the upper limb. So today now time is going to finish. We could discuss only this. Milkmaid sign, it is not in the myotonia dystrophica. It is milkmaid sign. It is in extra chorea, extra pyramidal movement. Very right. Inshallah, we will discuss the scheme of chorea as well because it is also appearing in the exam, right? So now I'm finishing my lecture here. If you have any question, you can ask in the group. Inshallah, I'll announce within a day or two. We will discuss its myotonia dystrophica interactive session. I will ask from you its presentation, right, and how to investigate, how to manage. Okay. So thank you very much for being here. It's always nice to be with genius people and stay safe and stay healthy. Inshallah, see you next time and very soon.
Thank you, Doctor.
Okay.
Thank you.
Okay. Thank you. Bye.